Greetings, campers, and welcome to the latest in our Canadian Artists Network webinar series, Creativity and Art, Lifelong Protection for the Brain. I'm Scott Walker. I'm the Executive Director of the Canadian Artists Network, and like most of you, I am also a senior professional artist. We welcome artists today from right across Canada to this session, and I'd like to begin by acknowledging that we live, work, travel, and create on the traditional territories of Indigenous peoples who have cared for this land, now called Canada, since time immemorial. We acknowledge this as part of our covenant with all Indigenous nations to share, respect, and protect the land in the spirit of peace and friendship, and to honor the future generations of all of our nations. Well, a couple of days ago, there was a news article on the subject of dementia, and it reported that there are 770,000 people in this country who suffer from some sort of cognitive impairment. And that number is likely to increase to 1 million within the next few years. And it was by way of introducing a new Alzheimer's drug that could very well be made available. It's called lecanemab. They come up with great names in the pharmaceutical industry, but it will be marketed under the equally engaging name Leqembi. The problems are that it costs in the US $25,000 per year, and the results, they say, are modest, and there are side effects. Well, we're going to talk about another way to deal with dementia today, with the only side effect being joy. And I'm sure questions will occur to you as you listen to our presenter. We'll ask you to put them in the Q&A box, and we'll try to get to as many of them as possible. Our presenter is a consultant for behavioral neurology at the Memory Disorder Clinic and the Geriatric Mental Health Outpatient Program at St. Michael's Hospital in Toronto. This is his third time joining us to talk about art and the brain. Welcome back, Dr. Luis Fornazzari.
Thank you so much to be again with you. And as I'm not only feel so proud and so grateful because, as you know, I've been working in our memory clinic and in all our activity with artists of all types. And between us, I'm learning more about how the brain works with my artists than with my colleagues. But anyway, the talk of today is not only to talk about the neurodegeneration and the brain disorder, but how we are advancing in such an incredible speed in all aspects of neuroscience that as I started in Canada in 75 in Vancouver, then in Toronto, and then stay in Toronto. All this new neuroscience is really changing. And this is, I want to share with you. And at the end of the talk, obviously, we're going to leave a lot of time for questions that, as also we commented, I learn more from your question that I hope that with my answer. So disclosure, all the objectivity of this talk is absolutely transparent in the sense that I don't have any affiliation or funding, etc. But I've received tremendous help from Johann Sebastian Bach and from Schubert. And why I say that? Because in one of our studies, that is the only one that I'm going to promote today here, we discover with our teams that when we are exposed to long-known music that you like, and you are studying or solving problem or even creating, as is your case, the brain affect in such a way the functional connectivity that improve all kind of high cerebral function, memory, attention, etc. So we were perhaps the first our team, that any musical intervention, and by the way, art intervention, is a prevention, a person for Alzheimer's disease, or even any other disorder that have some cognitive issues. And why, as I said, we are in a totally different neuroscience world? Because neuroscience went away from a pure biological, discipline, and thanks to psychology, philosophy, computer science, physics, maths, biology, engineering, linguistics, archaeology, and art and humanity and ethic and law changed their approach. The approach now is what I modestly call the renaissance of the new neuroscience. And what that mean? That mean that the neuroscience went out from their laboratory, mini laboratory, cells in laboratory, and based on this tremendous influence, now they are discovering and they are propagating and they are inspiring by this discipline. Example, very simple science, the best ever, science journal, discovered a few years ago using uranium thorium that, the art in the caves were not only around 40,000, but are now scientifically proved almost 60,000 years ago, proving neuroanthropology that Neanderthal were very intelligent. When we study, anthropology in the past, Neanderthal were not so intelligent. Were we, the Homo sapiens, the one who were intelligent? Not so. In those recent discoveries using the new techniques, we recognize Neanderthal were as intelligent. So in our very precious evolution, well, we are receiving more and more information from there. The new science of mind is the work of Eric Kandel, our beloved Nobel Prize 2001. He, in advance from this, new renaissance in neuroscience, integrate all these disciplines, as you see there, and please, perception of art, as one of the major influence. And why is so fruitful influence? Because as you see, the disorders of mind, so all the big psychiatric issues are also, very thoroughly investigated through the new neuroscience. So when I talk with my students and my residents in psychiatry, neurology, etc., I always said, well, don't forget, we are clinical neuroscientists. So we need to apply what we know in neuroscience about that. Is that new? No. Ramon y Cajal, Nobel Prize of Medicine in 1901, he was in a very artistic way received when he received the Nobel Prize, because he was the one who discovered the neurons and how the neurons, the cerebral cells were working in the brain. And look at the beautiful artistic description. He says that when he was looking in the, optic microscope, 1901, the gray matter, the neurons in the brain, the attention had changed in the gardens of gray matter cells with delicate and elegant shapes, the mysterious butterflies of the soul, whose beating of wings may one day reveal to us the secrets of the mind, is almost prophetic. A century later, we know that those butterflies are the ones who explain practically all the secrets of the mind. Well, advances. These are electronic microscopic with very recent technique of our nerve cells, our neurons. When Ramón y Cajal described, he postulated, Nobel Prize, 1901, that the neuron, as you see here, was elaborating all what we think, thought, memory, sleep, etc., and transmitted only in this direction. And he also postulated that with the number of neurons that we were born, we were going to die unless we damage the neuron. Well, now we know exactly. We have 96 billions of these cells in our brain. And these 96 billions, each of them communicate with at least 5,600 of other neurons here. And they connected, as you see in this blue, one with the other in so-called synapses. In other words, they interchange electrically and chemically information, and that makes that this 96 billion is like a network of all over the brain. As you can see here, the connection is not only in the so-called synapses, but in many other areas of the body and the branches. You know, the branches is called dendrites in the cell. What is fascinating is that it's not true that the information is only in this way. The information is almost chaotic in the sense that this interchange of information is all over them and in all over the network. And it's not only that. 2 weeks ago, big discovery again. The communication is not only between that cell and many others, but all in the dendrites, in the other part of communication, they discover using nanotechnology, you know, the nanotubule. So the communication was not only in between them, but interchange like a mini multiple network. This, you know, dendritic nanotubules is something discovered 3-4 weeks ago. Isn't that incredible? Again, in my objective said that we need to discuss brain plasticity. The brain plasticity is an ability of these billions of cells inside the brain to rewire itself. Rewires when they receive some information. And this rewiring lasts all our life, even at the time of death. If we are submitted, for instance, and some emotional memory, those cells rewire and help, you know, others to accommodate to the moment, for instance, death. And this is something absolutely new too, because not long ago, you know, we believed that the brain became totally hardwired when we were a child and there was little or nothing to improve. But now it's 100% accepted. The brain retains this rewiring, this plasticity. And the important message here, and particularly for all of you, is that art in any of its form is a very powerful rewiring element in the cells. And as you see in these modern microscopic, electronic microscopic, cells are interchanging spaces and interchanging functions in, in all aspects of the brain. Well, art and science, science and art, is something recent. Well, European culture in 1751 through the Encyclopédie Française, well, suggests that, art and science are mutually supportive. It's a shame that bonds them together. But obviously, when you do a little exploration about this art and science, notice that 2,000 years ago, Mesopotamia, India, Egypt, India, and China, already there was an impressive art and science, junction in such a way, not only in the ancient Greece, but we have the Islamic Golden Age in all over the world in those centuries, and the Renaissance, and finally the Enlightenment. So, in other words, art and science are with us since practically the origin of the humanity. So that's the reason why the art is so strong, human capability. And for instance, in not only about the example that I just did, but for instance, in the case of me in South America, when the Spanish conqueror came, already in Mesoamerica and now in South America, recent discovery, the indigenous population were incredible, educated in art, astronomy, urban planning, ritual, writing, architecture, you name it. So if art and science co-evolve, it means that this is something that was born together with the humankind, shaping our understanding of the world even long before the modern separation of discipline. Again, this separation of discipline I've seen very negative for our world, for our modern world. The other point that I want to discuss with you is that we consider, me and many other very valuable, very, intelligent and cultivated people, that art in any of its form is an instinct. By instinct, I mean those natural impulse, like language, like paternity, like maternity. So instincts are part of our human condition. And the inspiration came not only from the rest of the world, but close to us in 1923 by Marion Bauer, who was practically a prominent composer, musician, and interpreter, and also the founder of the Musical Quarterly, that he suggests very clearly in many of their talks that the art was an instinct. So it's part of the human nature, as important as language, as she said too. A few years later, Alexander, a philosopher, UK philosopher, when he gave the big talk in Oxford in 27, 5 years later, about the art creation and the natural instinct. Another, suggestion at that time that was such a powerful, that was like an instinct. And he was so brilliant that he suggests that art both proceeds from a specific aesthetic excitement in the artist and produce an aesthetic excitement or emotion in the spectator. or heal. So suggesting art after, after this exposition to the spectator, excitement and emotion. And well, new neuroscience coming back again. And obviously, this emotion that described, almost a century ago, is more complete. The art, the work of art produced by the artist, and I mean poetry, singing, improvisation, a dance, and acting, the word of an acting, induce sensation, knowledge, and emotion. And these three things that sounds like, oh, that's great, but is that simply few minutes? Is that, something that it go there and then disappear? The answer is no. The answer, based on the scientific knowledge, suggests that emotion, sensory, and knowledge activate practically the full brain in all their electrical and neurochemical aspects. So when we took in a few minutes ago about neuroplasticity, this is what the art is doing in our brain. It's changing practically all the neurotransmitter in the very positive way. And Eric Kandel, again, our Nobel Prize, when you go and see in a play or see a movie or go to the opera, well, you have all these kind of effect in your brain, and scientifically that activate many, but many areas of the brain, and they change, the function of those areas in a very positive way. So in other words, it's no question that the art is an instinct, it's a powerful element in our brain function. And we are helping our approach by distinguish, neuroanthropologists, archaeologists, philosophers, and all of them always, when approach this issue of the art instinct, said that art is a biological necessity. Art is an evolutionary adaptation. In other words, equal instinct. Art is an aesthetic rooted in the brain. So the brain is the one who have been influenced, and and this is proves in the prehistoric human being, and obviously is also a core part of a human condition. Distinguished, excellent books by distinguished scientific. So in other words, across all cultures, the creation and appreciation of art is not a luxury, it's a vital expression. It's what it means to be human. And a parallel, very briefly, as we consider language a powerful instinct, in our case, art is a powerful, instinct with all these things. So the issue is that the art is an evolved condition. In other words, we are inheriting from all our pre-hominid and all our ancestors, because there are in many suggestions there. Dementia. Dementia, as Scott suggests, is a world problem at this moment. And dementia is an umbrella. It's not only that 60 to 80% are due to Alzheimer, 5 to 8% due to Lewy body, vascular dementia, and frontotemporal dementia, and also some other form, secondary to Parkinson, secondary to Huntington. and the so-called mixed dementia. It have some more than one cause. And this dementia is a risk, yes. As also Scott suggests in your introduction, is affecting at this moment all over the world almost 50 million people, and in 250, they will be 150 million. What happened in our Americas, North and South Americas, will be an increase in almost 248%. In Europe, 90%. Africa, 345%. And Asia to 25%. And that's the reason why you see now that all the countries in the world, all the world organizations are concerned about dementias of all types. When Alois Alzheimer described Augusta Pitta in Tübingen University, he mentioned that this woman had what he called at that time a form of odd senile dementia. And he showed in the audience in Tübingen their preparation. And he suggested, with very clear scientific basis now, that was due to abnormalities in the neuron and abnormality in the space around the neuron. And he suggested that these plaques and these tangles inside the brain were the cause of the disease. And he was absolutely right until now. No question about that. So the conventional model of the Alzheimer is, yes, we have abnormality in some proteins that is called amyloid now, and tau, the one who is inside the brain, and transform the brain from a healthy brain in a pathological brain. The issue and the advances on the study of dementia are going to be very personal in the same. When I started in Vancouver, for instance, revalidating my Canadian experience as a neurologist, we investigate and treat dementia from this point on. Dementia due to Alzheimer, mild, moderate, severe. Now we are able to go almost, not yet, but almost 20 years before, what we call preclinical Alzheimer's disease or the mild cognitive impairment due to Alzheimer's disease. In other words, this is going to be Alzheimer's disease, and now we have elements to trying to suspect that those patients may develop the Alzheimer's. And we see that in this new, diagram, that mild cognitive impairment is here, dementia start there, but around 20 years before, in a normal brain, this abnormal protein, for instance, the amyloid, and the tau, they start to accumulate gradually there. Fortunately, we may have soon ways to detect before the disease starts clinically the deposit of this abnormal protein. In other words, 20 years, a nice, beautiful brain full of gray matter, the center of memory very well involved, the so-called hippocampus, who is like a seahorse. You see, art is always there, art and science. And then from 8 to 10 years until the patient with Alzheimer's died, how this increased the size and how the deposit of this abnormal protein start to increase and invade the full brain. But please do not forget that after 45 years of age, all of us, even if we never are going to develop any disease associated with dementia, we start to decrease our mental high cortical function of memory, orientation, numeric ability, verbal memory. Studies done in population in North America and in Europe clearly suggest that, yes, around 45 is the time that we really start to show those deficits, who are not abnormal, are the normal evolution of our brain. But what some investigators call crystallized intelligence, in other words, the judgment, the memory for words, the speech, continues to be good. All the others, are there. So that's the reason why it's so difficult at some time make the real diagnosis. Is this patient having some difficulty or is it normal evolution? A prominent investigation from Toronto, from Toronto, Donald Weber, is saying that with great the pathogenesis, the reason of the Alzheimer is so complex, are so many that it's not only the deposit of that abnormal protein, but there is immunological, inflammatory changes, abnormal function of the organelles, the micro organelles inside the neuron, that the oxidative stress that induce the Alzheimer's disease. So that is the reason why it's so difficult until now to find a proper treatment. Well, Lancet Commission, one of the most serious UK scientific organization based on Lancet, the journal, after many studies, promote the potentially modifiable, things that we could do in our life to protect our brain from dementia. And then those, if we continue to be educated and in midlife, correcting all these abnormal causes, and in the late life, avoiding the social isolation, the air pollution, the visual loss, we can, even if we're going to develop Alzheimer's disease, protect the brain at least in 50%. One of them, exercise, and all science is based about exercise. And you know why? Because when you do muscle activity, recent discovery again, the muscle develop a protein called irisin. Irisin is a protein that not only activate the small laboratories that we have inside all our cells, but decrease the fat and activate not only the neurons, as you see here, but many other areas of the brain and of the body. So in other words, obesity, diabetes, cardiovascular disease, cancer, lung disease, brain disorders, colitis, thyroid, are all benefit from this irisin, who is an hormone and is at the same time a protein that have a tremendous effect in all the brains, in all the cells of the body. And the name was after Iris, the goddess, the messenger goddess in the Greek tradition. What happened with cures? What happened with the medications that for all decades have been trying in this disease? Well, over the past 30 years, 99% of the small molecules drug trials for Alzheimer's disease have failed. But okay, I don't want you to be, pessimistic. Currently, there are so many agents trying to be effective in the disease, that at this moment, at least we have 2 of them approved by FDA, not in Canada yet, lecanemab and donanemab, for the use in Alzheimer's disease. What they do, those drugs clean the brain from that abnormal protein, the one who develop the, the plaques, those like cotton, who were glue material that trap the connection between the cells and avoid the connection in the cells. In between, beside all these other preventive things, there is a movement in the field of drug repurposing. In other words, other drugs who are good for inflammation, metabolic, cardiovascular, some of them are useful in help that brain who is suffering from Alzheimer's. And until now, in spite of hundreds of essays done all over the world, the most practical for immediate use are metformin, the classical medication for diabetes, sildenafil, Viagra, statins, all the statin use in high blood pressure and cholesterol, and vitamin B3 derivative and all the other vitamins. So there is positive thing. There are positive things. Well, when Alois Alzheimer described, the pathology in Auguste Dieter, this is the Alzheimer, preparation. He mentioned tau, right? Tau in the sense that was this protein abnormal inside the tremendous advances 2 weeks ago, in the sense that all the laboratories are trying to use tau as a marker, and at the same time trying to see how they counteract the tau invasion. Already we have tau, amyloid in the lecanemab and donanemab. I know that there is already some studies trying to block the tau. And why tau? In an excellent, healthcare system as is in Sweden, that, by the way, when I came to this country in 1974, the Canadian healthcare system was as good as the Swedish. They are now, after 4 years of promoting the use of a biomarker, in other words, a blood test that can give you the diagnosis of Alzheimer's. Now, 4 years later, they are using in primary and secondary care this marker, who is phosphorylated tau 217. Are we going soon to use it in Canada? I hope so. I hope so. These are the markers, in other words, blood tests that you can take in your physician's office, and they can tell you if you have abnormal amyloid, abnormal tau, and some other markers to make the diagnosis. So what we can do from our art point of view about the dementias and Parkinson's and some other neurodegenerative disorders. First of all, this is a study that corroborates the one that we did many years ago, that using music that the patient liked not only improve their mood, but all the brain functions. And why is that? Because music and art in general are a powerful activator of all these neural mechanisms. At the same time, all the neurotransmitters and all the, neurophysiological, electrical, increase neuroplasticity secondary to art. One distinguished psychologist, artist neuropsychology, Dalia Seidel from UCLA, suggests that art exemplifies neuropsychology in action. There is no more clear definition of what art is doing. And at the same time, don't forget that neuroplasticity is all the time increasing the neural connection, and this is what art is doing. And we're talking visual art, music, dance, writing, theater, activate so many, neurological system and all this scientifically based of multiple study that indeed using art is a healing in brain dysfunction. And movies, the new branch of art therapy, the so-called neurocinematic, based on very robust, neuroscientific finding, suggests that the intersubject, communication, when we see movies comparing when we see, any other images, is activate. So as you can see here, the study suggests, and they were under the EEG measurement, when you were seeing, the good, the bad, and the ugly, there was communication in many of the spectators, and they measure, for instance, the intensity of the communication, exchanging communication. The Alfred Hitchcock movies comparing with Leone and Larry David, and the other image was incredible, the interpersonal communication. Dance require not only all these, mechanisms, but by itself affect in such a way all these other, function that obviously all we should be dancing all the time, or watch dancing, or going to the ballet. And why is that? Because dance not only increase the motor sensibility, but all the other cerebellar and cerebral circuits, increase the control balance, emotional regulation, and it increase, the social adaptability, and decrease one of the worst things in elderly with the social isolation. What happens when you go and see a picture? It's not only that you enjoy the picture and you have happiness for a moment, but also improve all these other functions, activating all these brain areas that are going to help you not only with, trying to express your emotions, not with words, but at the same time, decreasing your stress, increasing your emotionality. And you go to the theater, the same situation, increase not only the memory, but reinforce your self-identification. Reading poetry, reading a novel, reading complicated technical books, same situation. Decreases stress, increase coping with your day-to-day activities. And why? Because they measure, after you read something that you like, the blood component, and decrease cortisol. So the stress hormone is decreased when you read a poem, when you listen to a song, when you trying to, and then when you use all form of arts plus mindfulness, I mean meditation, yoga, therapy, you have an increase brain function that protects your memory in this function. and to finalize all our life before we were born. Science, particularly our colleagues from Hamilton, from McMaster in the Artists Institute, demonstrated that as soon as our auditory and brain start to develop in the first few months, that system, when it's exposed, for instance, to the voice of the mother, or the songs of the mother, or the music that the mother is listening, they increase, they accelerate, and make when the baby is coming out to this world almost with knowledge about recognizing music, recognizing the familiar voices. And that explains why, all this, and I call tremendously, useful studies about those kids who are involved in music. This change their mind, they change their brain. And particularly in the group of kids who are coming from very deprived group of social people, and that is all over the world. For instance, this was started really in Chile in 1964 by Jorge Peña Hen, who created the first child symphonic orchestra in the north of Chile with deprived kids, and extended to the rest of the country. And then was followed by El Sistema by Abreu, and we have in Ottawa and in Manitoba, in all the Atlantic provinces, those kids in musical schools. And why is so powerful, so positive? The study done at Carleton a couple of years ago, and we were privileged to review the study, where they did an incredible study where kids deprived that were involved in the orchestra from Ottawa, they demonstrated after 8 months, when they learned to play, they learned to, to interpret the music, their brain changed, and changed in such a way that those kids who came either very timid, shy, with lack of control of impulses, poor memory, all these functions improve. And that's the reason why we have all this El Sistema all over the place now. And the group in California was very talented colleagues of us, Damasios, the Antonio and Ana. They not only demonstrated what the group of Carleton in our university in Ottawa suggested, that the playing of music, for instance, not only develop all this connection, but the most important finding in that study is that the connection between the left and the right hemisphere through this bridge, which is called the corpus callosum, was the bridge from all the fibers from right to left, was robust. In other words, the communication, the activation of both hemispheres in these kids after 1 year of playing music, reading music, or even singing, develop those brains. Manitoba and all the Atlantic provinces, and has our Dan Brown suggests music is a language. When he was working with the Sistema New Brunswick Children Orchestra, when he developed the premiere of the Wild Symphony, he was impressed also, as all over in the world, about that. Few words about Parkinson, the second most common neurodegenerative disease from now to a few more years, the amount of cases is going to increase, not only because of the aging population, but also because of the industrial pollution, etc. So the issue is what we are doing with Parkinson. Is Parkinson as good the evolution as the Alzheimer? The answer, I think, is yes. We have already way to make the diagnosis before the patient have the symptom of Parkinson's disease. And I hope the so-called alpha-synuclein, the abnormal protein that damaged that brain, is going to be detected in blood-based and also some imaging story. We don't have yet, like in Alzheimer, lecanemab, etc., but there are other ways of targeted drugs. So hope is there. So when we practice the precision neurology, combining these blood biomarkers, genetics, and digital tools, we are going to have some more positive answers. And again, when you go back, and this is a very recent paper, when you go to art is already a very powerful influence in the treatment of the idiopathic Parkinson's disease. And I'm talking not only dancing, who is practically an invention from our Canadian dancer, Sarah Robichaud. Music, dance, drama, visual art, creative writing improve not only the movement, but all the other symptoms associated with Parkinson's disease. So this is something that we need to finish, that art therapy is one of the non-pharmacological treatment modalities for many diseases, either neurological, psychiatric, and even physical disorder. So different type of art therapy, improve the quality of life of the patient, not only Alzheimer's, but also in Parkinson's disease. So, and this is only us, the group in Toronto, Montreal, Manitoba, Vancouver, but all over the world. The World Health Organization declared, after reviewing 3,000 studies, that art have a major role in prevention and promotion and management of disease, particularly our neurodegenerative disorder. My team, most of them have been my students and new students. Many of them are artists, musicians, writers, etc., are the ones who really inspire us, and particularly our patients. The artists that we are seeing for the last 20 years, and we're trying to discover what is the brain of those artists that protect from all these disorders. As usual, I finish all my talks with all schools should be art schools, because if we were all under art school, I'm sure that our world will be totally different now.
Luis, thank you so much. Thank you so much for this. Lots to unpack. I have a couple of questions for you, and I know a couple of others have questions as well. How close do you think we are to being able to go to our doctor and get a test that will show whether we have a tendency to neurodegenerative disease?
Very good question.
Thank you.
I think, we are very close. We need to be very close. We need to, because all the, and this, in our field, the behavioral neurology, psychiatrists, geriatrician, neuropsychology, we need urgently to have these instrument to make the proper diagnosis. So I'm sure that our organization are going to press, our health authorities that we need to include this in the battery. As we, take the blood sugar and we make the diagnosis of diabetes, we need to have that. Still, we need some more, because the Swedish system is so good, precise, that they're already using. In your community clinic, they are using the p-tau at this moment. We have p-tau, we have amyloid B40, B42. So there are many of them that can be used to certify, okay, this is the diagnosis. I think, really, Scott, that we should be close.
Good to know. But in the meantime, we can be singing and playing and dancing and writing and painting and
Going to the movies.
going to the movies. I was just going to say, because going to the movies or any kind of group performance where you're a member of the audience, I was reading recently, and I'm sure you know this term, that you experience what's called collective effervescence.
Exactly.
Which is everybody's having a wonderful time. And it doesn't have to be a comedy if you're going to a movie. You're just engaged in something together. And like that image you had of the brains, several brains firing and connecting at the same time. Although I wouldn't think a Sergio Leone movie would necessarily do that, but who knows? But when it comes, you mentioned Sarah Robichaud, and I happen to know that one of Sarah's colleagues is with us today. And I would be remiss if I didn't mention the program that Sarah founded called Dancing with Parkinson's, and that they have an online session every morning in online, and it's absolutely free. Anybody could take it. You just have to go to their website, Dancing with Parkinson's, to find out more about it.
Excellent. Excellent.
I have another question from one of our viewers today. This isn't necessarily about art, but it is about detecting early. Close friend suddenly exhibited behaviors indicating some form of dementia. Could this have been detected sooner if family and friends knew what to watch for?
Oh, yes. Yes. This is, again, we are hoping that the blood biomarker will be soon, but already there is other biomarkers. For instance, the PET scan, positron emission tomography, the one that have been extremely successful in the management of cancer, for instance. The PET scan with the marking of the amyloid or tau in the brain are a very good biomarker to trying to make the diagnosis. And the second biomarker is the cerebrospinal fluid, in other words, the spinal tap, that also there, those abnormal proteins from the brain that have been depositing from the last 20 years, they can be detected and measured. And this is universal. The issue is a PET scan is extremely expensive. The spinal tap is invasive with complication. So we are all in benefit of our patient wishing that the blood biomarker, the simple taking samples of the blood could give you the answer. This is one aspect of the biomarker. The other thing is as soon as there is suspicious that that patient is having different brain function should be assessed. Should be assessed in any of the other, so not only memory clinic. We have memory clinic in all over Canada now, but by neurologists in any remote area or neuropsychology, for trying to detect the findings that they corroborate. This is not a normal aging. This is going to be a form of Alzheimer, and start the intervention as soon as possible.
Somebody else is asking, would it be reasonable for a doctor to prescribe going to the theater or going to a concert as opposed to taking a pill?
Well, there is no side effects of any kind going to the movies, on the contrary.
Except, as I said, joy.
So this is no question about that. In other words, we need to promote more this intervention, the so-called music intervention, art intervention in the management of the disorder. I know that in many of our clinics in Toronto and Hamilton, we are very serious about the prescription. Even give me the idea that I should have a pre-print prescription with all these indications to my patient. Say, this is what you need to do. But again, this is something that is not very generalized yet. In spite that it's scientifically proved, there is no question that have been repeated and repeated study, but it's still not be well, integrated in the care of the patient. And it's sad because all our therapists, occupational therapists, physiotherapists, music therapists, are suggesting for the last 20 or more years that have a healing capability.
You may have mentioned this. Are your studies showing that actually engaging in art practice works better than being a passive participant?
The answer is yes. But even beholder, right? The beholder listening to the music that I lead, and I gave my own example, sorry about, the self, but, when you are a passive beholder, you have that positive effect. Obviously, the interpreter is the one who really, and the improvisation interpreter is the one who practically burns the brain of activity. Is incredible activator. Incredible activator.
Thank you for that. And thank you for this, Luis. This has been, as always, a joy to talk to you and to listen to your expertise. And I thank you for sharing it with us today.
Thank you so much. I feel privileged to be invited to talk to you and to the artists who are giving me tremendous information about, how to treat our patient with dementia and Parkinson's. Thank you.
Thank you, my friend.
Thank
We'll do
you.
it again.
For sure. Maybe mix, hybrid, maybe. I hope.
Okay. Thank you, Luis. Dr. Luis Fornazzari, who has been a great supporter of Canadian Artists Network. In fact, he and I met at a CAN event many years ago. I'd also like to thank the Azrieli Foundation for making today's webinar possible, and mostly thank you for being here today. And don't forget that all of our webinars, public relations, art and neuroscience, preserving the mind, art and neuroscience being one of Dr. Fornazzari's earlier presentations, copyright, social media, artistic legacy preparation, identity theft, fraud prevention, all the videos are on our website, canartnet.ca. So until we meet again, take care, be well, and have a creative day. We'll talk again.